By the year 2050, someone in the U.S. will have developed this disease every 33 seconds. Right now, there are more than 5 million Americans currently living with Alzheimer's. Nearly 500,000 people aged 65 and older will develop the disease in the United States this year. So with statistics like this, it's no wonder that Alzheimer's is such a big health concern for so many of us. Joining us to tell us the latest in Alzheimer's research is Beth Kallmeyer, who's the Vice President of Constituent Services for the Alzheimer's Association. Beth, thank you for joining us this afternoon.
Thank you for having me, Jimmy.
Okay, so we just heard the numbers, but it looks like not everybody is accounted for. Why is the disclosure rate so low?
The Alzheimer's Association 2015 Facts and Figures report looked at how diagnosis disclosure was handled with patients and families. And what we found is that Alzheimer's disease is handled differently than other diseases. So only 45% of people with Alzheimer's disease reported being told by their doctor that they have the disease. And this compares to 90% for the four most common cancers.
Okay, so the healthcare providers are accountable for these numbers. So that means immediate disclosure is important, isn't it?
Alzheimer's disease is progressive, so there's a small window of time where people are in those early stages where they can actively participate in making plans for their future, which is why the Alzheimer's Association is calling for additional education for medical students and practicing healthcare professionals so that they can deliver that diagnosis in a timely and sensitive way.
So can more problems pop up if the patient doesn't know?
Knowing that you have a diagnosis of Alzheimer's disease gives patients the opportunity to make critical financial and legal plans for their future. It gives them the opportunity to participate in clinical trials, to advance research. It also gives them the opportunity to make certain decisions about their life, maybe do things that they always wanted to do earlier than they would have so that they can enjoy that before the disease progresses.
Right. Okay, so we're hearing about blood tests that can predict. We're hearing about a new drug that may be coming down the line that can help people that don't quite have Alzheimer's yet. How far along are we really?
There's a number of really exciting prevention trials going on. People always want to know what they can do to prevent Alzheimer's disease. We need additional research dollars from the federal government. In fact, the Alzheimer's Association is encouraging the federal government to invest an additional $300 million in research in this coming year. And those things are so important because we know that there's some links between, say, healthy living and things that you can do for your heart that might be good for your brain, but we don't know exactly what's going to prevent Alzheimer's disease, so more work needs to be done.
Beth, do you think we could come up with a cure in our lifetime?
I sure hope so. It is the vision of the Alzheimer's Association, and it's something that we're committed to advocating for until that happens.
Okay, so we're talking about this report. Are there other big takeaways from this report?
So in 2015, according to the Alzheimer's Association Facts and Figures report, in Delaware, there's 17,000 people. In Virginia, there's 130,000 people. And in Maryland, in 2015, according to the report, there is 99,000 people living with Alzheimer's disease. And by 2025, so in 10 years, there's going to be 130,000 people. That's a 31% increase. That's pretty significant. So you've got a lot going on there in Maryland.
Beth, thank you so much for your time with us this afternoon. We've got to get in behind this and see if we can nip it in the bud. Now, if you'd like to learn more about the report, go to our website at WBOC.com and click on our picture at the top of the page, the Alzheimer's Association's 2015 Alzheimer's Disease Facts and Figures report.
Now you just heard Beth say the key to curing this debilitating disease is research, and some of that research is pointing toward Eastern medicine and herbal remedies. Could a seed really prevent and stop the progression of Alzheimer's? Well, one professor thinks so.
What we use to dry it down into a powder form.
Compounds within this plant, Professor Marilee Haran-Nair feels may lead to stopping the progress of Alzheimer's and possibly prevent the disease from the start.
These compounds, components from the seed, which is called vithanamides, they are very strong antioxidants.
Compounds that MSU and Professor Nair have a patent for and have tested on mice to try and stop the disease from spreading.
It goes to a specific region where it caused the damage. It goes and binds there from our modeling studies. And what then happened that it prevented the oxidation and prevent the rest of the events, which caused the cell death.
Cell death that can't be repaired.
Of course, it is a surprise when we see the results what we got.
Professor Nair says those tests of mice made a crucial breakthrough.
But in Alzheimer's treatment, you got to have your drug reach the brain. That's where the story comes.
And the natural products chemist says since this method's worked on mice, it should likely work on humans and has now been approved for human trials. So far, 300 people have already emailed Nair saying they'd like to participate.
We've talked about the need to do them in special environments and so forth, and when you start going to human consumption of anything, in this case a potential drug, you've got to take extra special care.
Care that could cost close to $5 million to conduct the study, but once they have the funding, results could be seen within a year.
If it happens, then it's ready.
Ready to help those battling Alzheimer's.
Looks like promising research. Something else that seems promising, a new drug being tested right now in New York. The drug is referred to as T817MA, and it is designed to protect against loss of nerve cells in the brain. Researchers say they hope it can prevent cognitive decline, disease progression, as well as clinical changes that happen. The study plans to enroll 450 people with mild to moderate Alzheimer's disease at about 50 hospitals across the country. Some $566 million was spent on Alzheimer's research last year alone. Well, it's always exciting to hear about major breakthroughs in healthcare, and more healthcare is being delivered outside of hospital walls. Still ahead on DelmarvaLife, we'll learn more about home health care, how it's changed over the years, and why people tend to get better faster when they're in their own home. Well, next best thing to good health is money in the bank for some, but saving that money can be challenging. We'll have some simple tips on how to be ready for that rainy day. DelmarvaLife will be right back.